Please note, all scenes in this video are sample procedures based on the PIDAC Environmental Cleaning Best Practices. However, your procedures may vary according to the tools, equipment, and cleaning products being used within your facility. Also, the use of any logos and products seen in this video is not intended as an endorsement.
Notes. 1. If using two separate products for cleaning and for disinfection, repeat steps 1 to 11 with disinfectant after cleaning. 2. If this is a C. difficile room, repeat steps 1 to 11 with disinfectant after completing step 11, and repeat steps A to K with disinfectant after completing step K. Before cleaning the contact precautions room upon discharge vacancy, you must gather all the materials required for cleaning before entering the room, including an adequate supply of clean cloths, fresh cleaning solution, and hospital-grade disinfectant, which can be combined in one product, and a dust mop, wet mop, and bucket or microfiber mop. Clean your hands with alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Put on gloves and a gown before entering the room. Strip the bed and pillows and place the linen into a soiled linen bag. Roll the sheets carefully to prevent aerosols from getting into the air. Discard all the personal care items that may have been left by the patient, for example, lotions, creams, combs, and magazines. Remove all privacy curtains, window curtains, and shower curtains, and put them aside for laundering and cleaning. Discard all disposable items such as suction containers, soap, toilet paper, paper towels, and glove box. Remove soiled linen from the floor and place it in a linen bag. Remove the soiled linen bag to the door or pass it out to someone outside the room. Remove all debris from the floor and place it in the waste receptacle. Remove waste to the door, handling plastic bags from the top. Do not compress bags with your hands. Waste may be passed out to someone outside the room. Clean waste can. Be alert for needles and other sharp objects, and only pick up these objects using a mechanical device. Place the sharp objects into a container and report the incident to a supervisor. Remove the gloves and discard. Clean your hands with alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Put on fresh gloves. Use a fresh cloth saturated with cleaning solution and disinfectant. Be sure to clean with one cloth at a time, and then set it aside for laundering and use a fresh cloth to continue. If a bucket is used, do not double dip a cloth. Never shake the cloth. Change the cleaning cloth when it is no longer saturated with solution and after cleaning heavily soiled areas. Place the soiled cloths in a designated container or bag for laundering. When working from the least soiled areas, or low touch, to the most soiled areas, high touch, and from high surfaces to low surfaces, proceed with the following steps. 1. Clean doors, door handles, push plate, and touched areas of the frame. 2. Check walls for visible soiling and clean if required. Remove tape from walls and clean stains. 3. Clean light switches and thermostats. 4. Clean wall-mounted items such as the alcohol-based hand rub dispenser, the glove box holder, the top of the suction bottle, intercom, and blood pressure gauge. 5. If Environmental Services is responsible for checking and replacing sharps containers, check the sharps container and change when the sharps reach the fill line. Clean sides and bottom of the sharps container, but do not dust the top of the sharps container. 6. Check and remove fingerprints and soil from low-level interior glass partitions, glass door panels, mirrors, and windows with glass cleaner. 7. Clean all furnishings and horizontal surfaces in the room, including chairs, windowsill, television, night table, desk, support railings, ledges, or shelves. Lift items to clean the tables and pay particular attention to high-touch surfaces. 8. Clean patient-resident equipment that is not cleaned by nursing staff, such as IV poles, walkers, and wheelchairs, and move them to the door for removal or pass to someone outside the room. 9. Clean inside and outside of the patient-resident cupboard or locker. 10. Clean the bed, working in a systematic fashion from the foot of the bed to the head of the bed. Clean the top and sides of the mattress, and then turn the mattress over and clean underside. Make sure you also clean the exposed bed springs and frame. Check for cracks or holes in the mattress, and have the mattress replaced as required. You must also clean the pillows. In addition, you must inspect for pests. Clean the footboard, headboard, bed rails, call bell, and bed controls as well. It is essential that you pay particular attention to areas that are visibly soiled and surfaces that are frequently touched by staff, patients, or residents. Clean all lower parts of bed frame, including casters. 11. If there is a sink in the room, clean inside and outside of the sink, sink faucets, and mirror. Wipe plumbing under the sink. Apply disinfectant to the interior of the sink, ensuring sufficient contact time with the disinfectant. Rinse sink and fixtures and wipe dry. When cleaning the bathroom, use a fresh cloth saturated with cleaning solution disinfectant. A. Clean the door, door handles, push plate, and touched areas of the frame. B. Check walls for visible soiling and clean if required. C. Clean the light switch. D. Clean chrome wall attachments. E. Clean all wall-mounted dispensers and frames. F. Check and remove fingerprints and soil from mirror with glass cleaner. G. Clean the call bell and cord. H. Clean support railings, ledges, and shelves. I. Apply toilet bowl disinfectant to the toilet bowl and allow it to remain while cleaning the sink and shower tub to ensure enough contact time with the disinfectant. J. When cleaning the sink, clean all surfaces around the sink, vanity, or countertop. Clean inside and outside of the sink faucets, and the mirror. K. Wipe plumbing under the sink. Apply disinfectant to the interior of the sink, ensuring sufficient contact time with the disinfectant. Rinse the sink and fixtures and wipe dry. When cleaning the bathroom and shower tub area, clean inside and outside the area. Clean faucets, walls, and railing, scrubbing as required to remove soap scum. Inspect grout for mold and apply disinfectant to interior surfaces of the shower tub, including soap dish, faucets, and shower head. Make sure that there is enough contact time for the disinfectant. Rinse the shower tub and fixtures and wipe dry. Finish cleaning the toilet. Clean the toilet handle. Clean all exterior surfaces of the toilet. Clean underside of the flush rim. Clean the toilet bowl and flush the toilet. Once this is done, carefully remove gloves and clean hands with alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Put on fresh gloves. Replace the paper towels, toilet paper, toilet brush or swab, and waste bag. Also replace empty soap, lotion, and alcohol-based hand rub containers with fresh supplies as required, but do not top up liquid containers. When dry mopping the floor, start at the back of the room and work towards the door. You must keep the dust mop on the floor at all times once you've started, and use the swivel motion of the frame and wrist to change direction. Take your time to minimize any turbulence to prevent the dispersion of dust. Then carefully dispose of debris, being careful not to stir up dust. Do not shake the mop. Remove mop head for laundering. When wet mopping the floor, note that disinfectant is not required for the floors. If you are using a loop mop and bucket, place a wet floor caution sign outside of room or area being mopped. Immerse the mop in cleaning solution and wring it out. Start at the back of the room and work towards the door. Push the mop around baseboards first and pay special attention to removing soil from corners without splashing the walls. Turn the mop head over every 5 or 6 strokes. and rinse the ring mop if the area is greater than 3 meters by 3 meters or 9 feet by 9 feet. Repeat the procedure until the entire floor is done. Then remove the mop head for laundering. Empty and rinse the bucket. If you are using a microfiber mop, fill the plastic basin with cleaning solution. Place microfiber pads to soak in the basin. Then take a clean pad from the basin, wring it out, and attach it to the mop head using Velcro strips. Place the wet floor caution sign outside of the room or area being mopped. Start at the back of the room and work towards the door. Remove the microfiber mop pad when soiled and when finished cleaning the room, and set aside for laundering. Send the soiled microfiber pads for laundering at the end of the day. Remove your gloves and clean hands with the alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Put on fresh gloves. Replace the curtains, linen bag, and waste bag with clean items. Replace supplies such as alcohol-based hand rub, soap, lotion, paper towels. If this is a C. difficile room, repeat steps 1 to 11 after completing step 11. At this point, remake the bed according to your facility specifications. If the room is carpeted, steam clean the carpet and soft furnishings. If room is not carpeted and you're dry mopping the floor, proceed with the following steps. When dry mopping, start at the back of the room and work towards the door. Keep the dust mop on the floor at all times once you've started, and do not lift the mop off the floor. Use the swivel motion of the frame and wrist to change direction. Take your time to minimize turbulence to prevent the dispersion of dust. Move furniture and replace it after dust mopping, including under and behind the bed. Carefully dispose of debris, being careful not to stir up dust. Do not shake the mop. If room is not carpeted and you are wet mopping the floor, note that disinfectant is not required for floors. If you're using a loop mop and bucket, place the wet floor caution sign outside of the room or area being mopped. Immerse the mop in cleaning solution and wring it out. Push the mop around the baseboards first, paying particular attention to removing soil from the corners. Avoid splashing walls or furniture. In open areas, use a figure-8 stroke, overlapping each stroke. Turn the mop head over every 5 or 6 strokes. Mop a 3 meter by 3 meter or 9 feet by 9 feet area, then rinse and wring the mop. Repeat this until the entire floor is done. Then remove the mop head for laundering. If you are using a microfiber mop, fill the plastic basin with cleaning solution and place the microfiber pad to soak in the basin. Take a clean pad from the basin, wring out, and attach it to the mop head using Velcro strips. Place the wet floor caution sign outside of the room or area being mopped. Remove the pad when soiled and when finished cleaning the room, and set aside for laundering. Send the soiled microfiber pads for laundering at the end of the day. Remove your gloves. Remove your gown carefully to avoid contamination of clothing or skin. Untie the strings first, then starting at the neckties, pull the outer contaminated side of the gown forward and turn inward. Roll the gown off the arms into a bundle. It should now be inside out. Discard the gown immediately into a soiled linen bag or waste container in a manner that minimizes air disturbance. In other words, don't toss it in the bag. Clean your hands with alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Gather cleaning materials and leave the room. After cleaning, remove the contact precaution sign. Report mold and cracked, leaking, or damaged areas for repair to your supervisor. Return cleaned equipment, such as IV poles and pumps, walkers, and commodes, to the clean storage area. The tools used for cleaning and disinfecting must be cleaned and dried between uses, such as mop heads and cloths. Launder mop heads daily. All washed mop heads must be dried thoroughly before reuse. Also, send curtains out for laundering. Clean the housekeeping cart and carts that are used to transport the waste daily.